Hello. This presentation is an introduction for small group facilitators participating in teaching Medical Neuroscience and Behavior in academic year 2019-2020. I'm Ian Paul, and I direct this course. First of all, welcome, and thank you for volunteering for this teaching role in medical neuroscience. Over the past several years, both students and faculty have found the small group patient encounters and the role of clinicians in coaching student doctors and facilitating group discussion of the cases to be a tremendously valuable component of the course. In this presentation, I will describe the course objectives for medical neuroscience. I will also describe the new flipped classroom course structure and the use of the Canvas Education Management package to access course material. I will explain your role as a small group facilitator and give you some tips on giving feedback to the student doctors and facilitating group discussions. Finally, I'll explain the grading rubrics that I will ask you to use in assessing student assignment. As I mentioned, I am Ian Paul and I direct this course. I'm a professor of psychiatry and human behavior and director of medical student education and psychiatry. The course coordinator is Barbara Daniels, and the administrative assistant is Latiana Collins. Our contact information is listed here, as well as the course syllabus on Canvas. In addition to our previous personal emails, you'll note the PsychMSE email address. This is a central mailbox that is checked by all three of us. At times, you may find that you get answers faster by using that address. Medical Neuroscience and Behavior 2 is a systems-based M2 course focused on abnormal structure and function of the nervous system and behavior. It integrates material from psychiatry, neurology, neuropathology, CNS pharmacology, and neurosurgery. In the medical neuroscience sequence, it follows the M1 Medical Neuroscience course, which focuses primarily on normal structure and function. In addition to being horizontally integrated within the M2 year, Medical Neuroscience and Behavior 2 serves as a vertical bridge between the largely basic science M1 courses and the clinical experience in the M3 year. After completing Medical Neuroscience and Behavior 2, students should be able to demonstrate knowledge of the signs and symptoms of common neurological and psychiatric disorders. They should be able to conduct a neurological exam and a psychiatric interview in encounters with patients and identify relevant signs and symptoms. From that information, the student should be able to formulate diagnoses and appropriate treatment interventions. Prior to 2015, most neuroscience-related content was presented in lectures with the students assuming a relatively passive role. Over the 4 years from 2015 to 2019, student learning was shifted to more active case-based learning, but still heavily relied on lectures. This year, we are using a flipped classroom approach where almost all class time involves active student participation. So why this change? Well, lecture-based teaching is largely passive and for many years was the only means other than textbooks of conducting most education. However, we know that learner characteristics change during development. In pedagogy aimed at children and adolescents, learning is heavily teacher-dependent. The teacher identifies what and when material is learned. Learners have little prior experience and so rely on the teacher to provide a framework. As a result, the teacher is in control and learning is largely the acquisition of knowledge: who, what, where, when, and how. Finally, the motivation for most learners is external: parents, teachers, and schools. However, as Malcolm Knowles observed, in andragogy, that is adult learning, the process changes markedly. Adults are self-directed and evaluative, and their learning is heavily dependent on prior knowledge. Moreover, adult learners value relevance and immediate application of knowledge. Finally, adults generally learn best by problem solving and their motivation to learn is largely internal. A flipped classroom makes use of the features of andragogy. Students engage initially with material in a self-directed way to obtain foundational knowledge. A content expert reviews and assesses student learning, filling in gaps, correcting misconceptions, and introducing students to the application of their foundational knowledge in problem solving. Finally, students apply their learning with guidance as needed in an independent or semi-independent problem solving, preferably in settings that mimic real life. In Medical Neuroscience and Behavior 2, students engage with the factual content via online presentations in Canvas that are accompanied by self-testing. Students then engage with clinicians in guided case analysis using between 8 and 12 interactive cases in a large class environment. Finally, students engage in individual practice by examining standardized patients in a small group setting. Students are coached and guided in that setting by you, the small group facilitator. The general format of Medical Neuroscience and Behavior 2 is 12 general topic blocks of about 1 week each that begin with self-directed learning and proceed to guided case reviews and finally small group work with standardized patients. The course begins with 6 topic blocks in neurology that open with pain management and substance use to coordinate with material presented in the Introduction to the Medical Profession course. The rest of the neurology topics are neurotrauma, seizure disorders, movement disorders, neuromuscular disorders, and stroke and vascular diseases of the central nervous system. The transition to psychiatry begins with neurocognitive disorders and is followed by stress, trauma, and mood disorders, anxiety disorders, psychotic disorders, personality disorders, and neurodevelopmental disorders. All course material can be accessed through the Canvas learning management software. There you can find the syllabus, schedule, teaching material, and cases for guided case review, and for the standardized patients in the small groups. You can log in via the UMC intranet under the Education tab, or go directly to umc.instructure.edu. Once in Canvas, Medical Neuroscience and Behavior 2 is listed as conjoint course number 628. In the next few slides, I'm going to walk through accessing Canvas and some of the important components you may want to use. From the UMC intranet, choose the Canvas icon under the Education tab here. This will take you to the Canvas homepage. From there, click on the course icon here. Once you've reached the course homepage, you have access to all class material. You have viewing but not editing rights for the course material, so don't worry about damaging anything. 3 important tabs for you are the current copy of the syllabus, which you can access here, instructional material that is accessed here, and the class calendar here. All of the student study material is available under the Modules tab. Each topic within a general block is typically organized in 4 modules. The first is a study guide that lists the available material and references other materials such as textbook chapters for deeper learning. Next, students complete a Readiness Assessment Test, or RAT. This is an ungraded quiz of 3 to 5 questions aimed at letting students know whether they are familiar with key concepts needed to understand the learning material, such as the lecture. The third module is the actual lecture or other teaching material. After completing the learning material module, students complete a formative quiz. This is a very low-stakes quiz that tests whether the students understood the key elements or take-home points of the learning material. At the end of each general topic block, there are 2 modules that are of particular interest to facilitators. These are the guided case reviews and standardized patient scripts. They are only accessible to teachers in the course, so please do not share this material with the students. As a facilitator, you will be guiding one of 9 groups of approximately 16 students. For grading purposes, each small group is subdivided into 2 case groups. A pair of student doctors from each case group will examine or interview a standardized patient. The standardized patients each present with the symptoms of one of the disorders covered during that week's topic block. That means that in each small group session, 4 student doctors will examine 2 standardized patients. This table describes a suggested process for conducting a small group session. You have up to 2 hours with your small group. Depending on the cases presented and their difficulty, you may need less time, but please make sure to dismiss the group to allow them at least 10 minutes to get to other scheduled activities. Following the small group session, the student doctors will prepare and submit case write-ups, and their case groups will prepare and submit differential diagnoses. Your first job as a facilitator is to coach the student doctors through the examination of the standardized patients. As a coach, try to allow the student doctors to make their way through the exam, but if they get stuck or miss something important, you can suggest or demonstrate other questions, tests, or the like. After the examination, dismiss the standardized patient and give the student doctors some feedback on their work. If you have a serious criticism that might embarrass a student doctor, avoid giving it in front of the small group. Provide it privately after class or write it in your comments in their case write-up. After giving the student doctors feedback, your job is to facilitate discussion among the whole group. I'll talk a little bit about that in a moment. Finally, I'll need to have you review and grade the student doctor's case write-ups and the case group's differential diagnosis. A great way to give feedback to student doctors, and even to medical students in the clinic, is the 1-minute preceptor model. In this model, rather than the traditional ward case presentation, you focus on a small part of the case. Start by getting a commitment from the learner, for example, asking the student doctor for their initial diagnosis. Then probe the student for supporting evidence, such as asking what signs or symptoms led to that diagnosis. Next, teach a general rule. For example, here is a common sign to help with that differential diagnosis. Reinforce what the student did well, and finally, correct errors. In that final step, don't try to be comprehensive. Focus on 1 or 2 important errors for the student to correct. Try to make sure your feedback is SMART. That is, it should be specific, avoiding vague comments. It should be measurable, and it should be actionable. That is, something the student can actually change. Be realistic. These are M2s, and this is all pretty new to them. Finally, keep it timely and focused on the immediate situation. Here are a few tips on case discussions. First of all, remember that the students should be driving the conversation as much as possible. It's okay to nudge the discussion to keep it on track and focused on the case, but avoid giving your own diagnosis or differential. Case discussion is a great place to give students tips and hints to help them become proficient in formulating diagnoses and treatments. It's also good to link the discussion of the cases seen in small groups to other disorders, especially within that week's overall topic theme. Try to have some conversation starters ready, like the one shown here, to help the group get going. Finally, be watchful to try to include all students. Balance the gunners and draw out the wallflowers. A good approach is sometimes, "You've raised some great points, Amy, but I'd also like to hear Sarah's thoughts on this topic." Each week, the 4 student doctors in your group will submit case write-ups to the Psych MSc office, and the case groups will submit a differential diagnosis for each of the patients. After the Psych MSc office retrieves these submissions, Latiana or Barbara will send them to you along with a Qualtrics link for grading. Please try to complete your grading within 10 days of receiving the material. For case write-ups, you'll have a 10 to 12 item rubric, which I'll show you in the next slide. All you need to look for is the presence or absence of the elements. Don't worry about style here, although constructive feedback is always great. This is also a good place for private feedback to the student doctors about their examination of the patient. Finally, there are 3 elements for style. Use your own judgment on each of these, but be generous and bear in mind the training level of the students. Then, just submit the rubric in Qualtrics and my office will take care of the rest. Here are the elements for neurology and psychiatry case reports. Again, if an element isn't relevant to your student's case write-up, just click NA, not applicable, in Qualtrics. The differential diagnoses are even easier to grade. They're also rubric-based, but have only 2 elements. First, did the group come up with at least 5 reasonable diagnostic possibilities, including a non-neurological or psychiatric disorder that could account for the presentation? Second, did they include evidence justifying each possible diagnosis? As with the write-ups, once you've done that, just submit your graded rubric via Qualtrics. That's it. If you have questions, please drop me a note via email. Thank you again for contributing to this course.